So the attitude towards breastfeeding in India is generally influenced by social, cultural, and economic factors. In fact, many women fail to openly share their problems, and choosing between work life and breastfeeding becomes quite challenging for them, whether be it breastfeeding or maternity concerns. World Breastfeeding Week gives us an opportunity to educate, promote, and support progressive trends to normalize breastfeeding as a special bond between the baby and the mother. Today we have with us Dr. Sumita Saha, who is a neonatologist and a pediatrician at Fortis Hospital Kolkata, to discuss with us all about breastfeeding. Welcome, Doctor, to India.com and the health site.
Hello.
So, doctor, as you know that we are in a pandemic situation, and breastfeeding mothers are also apprehensive. So, about COVID-19 and breastfeeding. So, can the lactating mothers receive the COVID-19 vaccine?
Yes, of course. So now from India, Government of India, it's been advised to give COVID-19 vaccine to both pregnant mother and lactating mother, and it says that it is safe.
Right, doctor. And is it true that, some vaccination spike specific antibodies induced in the breast milk? So how does it affect the baby if it actually does?
So antibody, our main aim of the vaccination is to produce antibody, and antibody is good for the baby. So the antibody which is produced will be secreted to the breast milk, will be going to the baby's body, and that will be helpful for baby to prevent infection in their body also. So this is good. There's nothing wrong.
So that means, all the lactating women should definitely go ahead and take the COVID-19 vaccine, as it has been, approved by the Indian government as well. And so, doctor, if you take the vaccine, does the vaccine antibodies also protect the baby?
Well, these are the new things. So all the vaccines and the whether it will produce the effective immunity for the baby, I don't think the data is still available, and it will be available in near future. But hopefully, the antibody will secreted through the breast milk and will give some protection to the baby as well.
And doctor, what advice you would want to give to the lactating and breastfeeding mothers as to what guidelines they should follow when they are breastfeeding?
I think there is some CDC guideline regarding the breastfeeding and vaccination, but the majority of the mother will have simple little bit of local pain and fever. They can take Calpol for that. Within 2 weeks, any other sort of severe problem, including any blue area in the body, they should go to their doctor.
Well, in the world, there is a large number of women who have breast cancer. So the association between breastfeeding and cancer risk, what it is and what evidence do we have?
So breastfeeding reduces the breast cancer risk, that is known. First study was published in 2002 in a big journal, and that was done almost 1.5 lakh mother, and it shows that that breastfeeding for 9 months to 1 year reduces the risk of cancer almost 4.5 to 5%. So that is quite significant value. And then there are a couple of more studies were sort of published in 2007 and 2000, I think 15 or 16. There was another study. All of the studies suggested that the significant amount of breastfeeding reduces the chance of breast cancer significantly. And so it is important that especially those mothers who had any risk factor of breast cancer, that means that anybody in the family between the mother or the sister has got the history of breast cancer, they should definitely breastfeed at least to 9 months to 1 year, and that will help mother to reduce the chance of breast cancer.
Right, doctor. So, women shouldn't fear that, breastfeeding would later lead to breast cancer, because as you mentioned that, it reduces the risk of breast cancer. And any other advice you would want to give to the mothers that they should specifically follow, and what is your take on that?
So there are quite a few advice I want to give to the mother. First of all, that mother from the antenatal time, they should be take a proper action or take a proper mental strength, that they want to breastfeed for exclusively for first 6 months. That is very important. Mental strength, mental willpower is the most important thing, and that's the word we want to give through this all this message, that they have to think, yes, this is important for them. This will have less chance of infection, less chance of allergy, better IQ, better bonding with the parents. Mother will have less chance of breast cancer. Mother will have good chance of weight loss, and they should have the intention to breastfeed completely to their baby. There are, and of course, it will reduce the expenses quite a lot. So one breastfeeding of one baby costs almost 5 to 9,000 per month, which is quite a lot of money. And so and reduces the risk of quite a lot. Now, one important thing that when you are breastfeeding, you need to keep checking the weight at least 2 weekly or 4 weekly to the pediatrician, so that they make sure the baby is healthy and growing well, and maintain the hygiene. Of course, the hygiene, maintaining of hygiene is more important when you are bottle feeding. Breast milk is naturally sterile thing. So it just continue the breastfeeding and have a good healthy diet. Remember, mother should remember that they are not feeding for themselves only, they are feeding for themselves and their baby. So good healthy nutritious diet and breastfeeding.
Right, doctor. So, they should, all the breastfeeding and lactating mothers, they need to maintain hygiene and need to make sure that they're having proper nutritious food, and also taking care of their mental health. So these three things need to be followed to the Q. Thank you so much for taking out time for India.com.